arms towards the sun, you feel the warmth of the rays, and then you know you're alive and you don't have to be afraid of anything, 'cause you know the truth, and the truth is love, yes it is. Wasn't what they said to you or anything that you learn from a book or from the news. It's not like that, 'cause it's a thing. It is something that you do.
Welcome to the Bassline, everyone. Dr. James Thorp MD is an MFM, a doctor of maternal and fetal medicine. When the fake vaccine onslaught was underway, Dr. Thorp was one of the courageous doctors on the right side of history. Despite being recognized on numerous occasions for excellence in his profession, he came under fire when he fulfilled his oath to protect his patients. I've noticed Dr. Thorp to be quite a gentleman, but he's also quite fiery when it comes to the crimes that have been inflicted upon us, the population of this country and the population of the world. I eagerly await this conversation with the undaunted Dr. James Thorp. Welcome to the Bassline this afternoon, Dr. Thorp. How are you?
Jeremiah, I'm very blessed today, and I'm very appreciative to be on your show with you. Thanks for having me.
Oh, it's such an honor, Dr. Thorp. I've been listening to interviews that you've done previously all week in preparation for this interview, and I really think that you're a very important voice in this struggle. And it's really great timing because we recently had your colleague, Dr. Kimberly Biss, discussing some of the terrible things that have been witnessed. And it's incredible to have you on now to follow up in terms of this very specific area of medicine, which is an interesting term maybe most people are not familiar with, an MFM, a doctor of maternal and fetal medicine. Could you tell us a little bit, Dr. Thorp, in terms of some of the distinctions in terms of your credentials? Like you're an MD, you're a medical doctor to begin with, but then you're also an OB-GYN, but then there's also this additional classification of MFM, maternal and fetal medicine. Could you describe that for us a little bit?
Sure, I'd be happy to, Jeremiah. Yes, I've been in practice now. It'll be, it's 45 years now. But I am an MD, and I am board certified in obstetrics and gynecology. And I originally had my board certification just long ago, 1985. Now, there's about 60,000 OB-GYN docs in the American College of Obstetricians and Gynecologists. Most of those are in the United States.
Right.
So there's a lot of OB-GYN physicians. Mm-hmm. OB-GYN physician requires a 4-year residency training after medical school.
Right.
But then in order to become board certified in my subspecialty of OB-GYN, now what is required is an additional, it's called, instead of a residency, a fellowship. This is a 3-year program, and again with extensive written testing and oral board testing after that process. So in terms of the volume, we're very, very few and far between. In fact, I was on the board of directors at the turn of the century for a 3-year stint with the International Society for Maternal-Fetal Medicine Physicians. That's SMFM, the Society for Maternal-Fetal Medicines. At that time, I think we had about 2,000 or maybe over 2,000 practicing maternal-fetal medicine specialists in the United States, close to that number. So in contrast to the 60,000 OB-GYN docs, there's at the turn of the century, there was only 2,000 maternal-fetal medicine itself. But interestingly, due to a variety of circumstances, that number has dropped now. I've heard numbers as low as only 1,200 of us in the country now.
Wow.
practicing.
Wow, that's remarkable.
So we're few and far between, and because of the scarcity of us at this point in time, we're in really, really high demand. But yeah, it's an extensive amount of education, investment, huge number of both written examinations and oral board examinations. Yeah, it's quite a process now.
That sounds very rigorous, but I guess it should be considering the nature of the job, right? We don't want anybody just tooling around over there. We want really highly and well-trained people. But within your profession, can you get into this unfortunate situation that we're dealing with nationally and globally in terms of the range of troubling things that you've observed since what we'll call the rollout?
Absolutely, I will. Keep in mind that I was employed by one of the largest Catholic healthcare institutions in the country, almost a $10 billion system, and that was SSM Health Systems. And they're associated with an academic, we were in an academic situation there because they bought out St. Louis University of St. Louis. So in our division, I was the most senior physician, the most published. And by the way, I saw by far and away the most patients because I am so experienced. And I give you an idea. I saw probably 27,500 patients in just the last 4.5 years that I was with SSM Health, that's Sisters of St. Mary's Health. And that was 5 times the volume that some of the junior maternal-fetal medicine specialists saw, and over twice the volume of the other more senior physicians in the division of maternal-fetal medicine there. So I say that not to brag or anything like that, just because I am highly experienced, and I saw by far and away far more high-risk OB patients than anybody in that system, and I would venture to say maybe anybody in the country. I say that to bring to your audience that really I have my fingertips on the pulse of high-risk obstetrics during that time like nobody else.
Right.
I saw just a huge volume. So my observations can't be discounted. And what I saw in clinical practice literally in 2020 was really nothing, really nothing. I mean, all the hospitals kind of closed down and everything, but there wasn't, I did not see an increase in obstetrical problems. I did not see an increase in miscarriage. I didn't see an increase in stillbirth or what we call fetal death. By the way, a miscarriage is a very common event. It occurs usually in the first 12 weeks of pregnancy, but it is defined as a pregnancy lost before 20 weeks. On the other hand, a fetal death is quite much more rare, and that's where the unborn baby, the preborn baby, dies in the womb at or after 20 weeks. So I didn't see an increase, and in fact, the national statistics, and why do I focus on 2020? Well, because this is a subterfuge of the chicaneриsts, the people that want to hide the problem with the vaccine, because they ascribe all of these complications to the vaccine. To the COVID-19 infection, when in fact it was not.
Right.
Not at all.
Right.
Anything could be further from the truth. In fact, national statistics showed, and I can quote you the actual numbers, that if you take the 3 preceding years of 2020 by national statistics, U.S. vital statistics from Statista, those 3 aggregated years before 2020, the fetal death rate or stillbirth rate was in the range of 5.83 per 1,000 births. And in fact, in 2020, it dropped. It dropped to 5.74 per thousand births. So there's no, I didn't see it, and the statistics that I just quoted you verify my observations are accurate. I started seeing the carnage after the rollout of the vaccine, after it was pushed on my pregnant women, and the carnage, it was unbelievable. First, a massive increase, huge proportion of patients that got the vaccine that weren't pregnant had very significant menstrual abnormalities, and we published on that through the My Cycle Story group, and others have followed suit. Saw a recent article that 50% of the women that were of reproductive age that got the vaccine had some type of menstrual disorder. But anyways, in my clinical observations and in pregnancy, massive increase in miscarriages. And the miscarriages were very atypical. Many of them were early, but many of them were more unusual timing, like after 12 weeks, like 13 weeks, 15 weeks, 18 weeks. These are heretofore very rare, very unusual. And then I saw a massive increase in birth defects, all types of birth defects, malformations of every organ system. You name it, heart, defects of all types of defects of every organ system, the heart, the brain, the spinal cord, and so on. And then I saw really significant placental abnormalities, very, very abnormal ultrasound appearances on the placenta by ultrasound. And then the placenta not serving the baby well, the unborn babies couldn't grow well, and there would be significant growth disturbances and abnormal testing due to the abnormal placental function.
Wow.
Fetal death, fetal heart rhythm disturbances, what we call fetal arrhythmia, blood clots in the placenta, what we call infarction or dead spots in the placenta. I saw a massive increase in severe preeclampsia. Preeclampsia is a condition unique to pregnancy, which is associated, it may afflict, 7 or 8, maybe 10% of certain populations, but this was just rampant, severe, early onset. And preeclampsia is a condition, interestingly, unique to humans. It's not seen in the animal model, but associated with elevated blood pressure, severe swelling, and protein in the urine. And it can present a very grave danger and can be life-threatening, both to the fetus and to the mother. And usually when we get severe preeclampsia, we have to deliver the baby. So I just saw a massive increase in severe preeclampsia. I saw an increase in preterm labor. I saw a substantial increase in cervical insufficiency, what we call a weak cervix, where the cervix, especially in twins, where the cervix would shorten and then you would lose the pregnancy or rupture membranes and deliver the pregnancy early and then have catastrophic outcome. So these are, then I saw catastrophic hemorrhage, especially catastrophic hemorrhage at the time of delivery, life-threatening hemorrhage that we couldn't stop. So this is what I saw with my own eyes, being the most experienced maternal-fetal medicine physician in my division at Sisters of St. Mary's Health out of St. Louis. And I would argue probably, I don't know of any other maternal-fetal medicine physician at my age, with my experience, that was seeing that high of volume of patients in this country. I don't think there are any.
Right. Well, wow. I mean, it's just so powerful what you're describing, and it just takes me back to sorry if this is redundant for my audience, but the Twilight Zone effect. It's a double Twilight Zone effect I keep pointing to because, one, these absurd things happened in terms of this rush to market product being forced upon the public and the recklessness of that. And that's part one. But then it starts getting really, really crazy and really weird when these observations are being made and then they're being completely ignored. Like, we just don't care about pregnant women. We don't care about children. We don't care about babies. We're just like monsters at this point. We're just that out of it that we can't respond to this information when it's being presented to us so clearly. And I would like to, and I'm sorry to bring up this unpleasant experience for you, Dr. Thorp, but I would like to discuss the controversial and sort of unusual manner in which you were fired, because, of course, there's this terrible history that still needs to be documented in terms of the doctors on the right side of history were summarily attacked. That anyone who is speaking up saying, hey, this is not proper procedure, this goes against the oaths that we have taken, et cetera, those people, instead of being commended, instead of being, acknowledged for the inherent truth in the things they were observing and pointing out, they were being attacked. So after all this experience that you had accumulated over the years, you'd been honored by multiple organizations over the years, recognized for excellence in your profession, and then all of a sudden, when push comes to shove and you're literally defending your patients, you then come under fire and you're terminated. Could you explain the circumstances of that, and just so our audience, really understands what transpired from a historical point of view?
Sure. Yeah, I'd be happy to. And by the way, it's not uncomfortable for me at all, because, in fact, I love talking about it because, listen, God gifted me by this firing a silver platter to pour forth and shine truth and expose exactly what SSM Health did. SSM Health, Sisters of St. Mary's Health of St. Louis, almost a $10 billion hospital system, one of the largest in the country, if not the world. They operate out of 5 states. And I don't mean to pick on SSM Health, but I will tell you exactly what they did and how it came about. First of all, as a background, I think that you and all the audience should know, and I'm shamelessly going to give your audience and yourself, if you go to the just Google America Out Loud News, and if you pull, I think your first hit should take you to the American Out Loud News platform, and there's a blue banner at the top. And if you go to the top of that banner, there'll be at the top right an options button. And in that options button, if you that'll slide down the right side of your screen, it'll go down to authors and contributors. You'll see a bunch of pictures of authors. Go down to my wife, Maggie Thorp, JD, an attorney, and me, Jim Thorp. You'll see our picture. Double click on that, and you'll see about 16 publications that Maggie Thorp, JD, a brilliant attorney and investigative journalist and incredible attorney, having quite a illustrious experience, career in seeking after fraud in large organizations, especially insurance companies. So anyways, Maggie and I have researched and published extensively on the fraud of every aspect of the pandemic. And these are not these are not hard to read articles. These are written for the layperson, but I call them medical legal briefs. So they're generally short, 2,000 words, maybe a few more, but they're highly referenced, meticulously cited. So I would just go back with regard, and there's a plethora. That's a gold mine. If you want to understand how this fraud was rolled out, in those 16 articles. It's extraordinarily well documented. In fact, we're writing a book on that. A publisher came to us and said, this is so good, we want to put all these together in a book and publish it, which it will be published hopefully later this year. But you can get it for free on the site. And I would point to the December article. And in December, Maggie and I published an article, and this is going to put my experience at SSM Health into context and help you understand and your audience what happened at SSM Health. And so what Maggie and I discovered was that, and we've documented it all, that the Department of Health and Human Services bribed over 420,000 hospital systems in the United States of America. I want to say that again because let this sink in. The Department of Health and Human Services, our government, bribed over 420,000 hospital systems in the United States of America with over $186 billion. Let me repeat that number again. $186 billion. Just go to that article and review it. And I think that I reviewed, listed there, there's 131 hospitals in the United States that took more than $100 million. Over 131 hospital systems, large hospital systems. It's just unbelievable. So SSM Health took $307 million in early 2021. Now, in order to take that money, they had to sign what I call cooperative care agreement. In other words, they had to join lockstep the exact narrative of HHS, CDC, and the FDA. And they signed an under-the-table, illegal, unconstitutional blood contract in order to keep that money. And they weren't allowed to break that contract. If they did, they'd have to pay, they would be penalized and have to pay all that money back. So this is why all the healthcare systems were corrupted. They targeted red states. For example, in Houston, Methodist Hospital was the first system they went on.
Right.
It was a system.
Yeah, actually, we had Dr. Mary Talley Bowden.
Houston.
Yeah, we had Dr.
Mary Talley Bowden.
Yeah, we discussed the strategic aspect of targeting Houston.
That's right. And they mandated the vaccines in the doctors and in the patients, essentially. So they used that as a first one. And after Mary Talley Bowden, was fired, and after the judge upheld that fraudulent narrative mandate for Houston Methodist, that was the primary hospital, and every single other, the 420,000 hospitals that took that money in the United States fell like dominoes immediately, and SSM Health was one of the first ones. So anyways, SSM Health, and I will brag on them. They were one of the best employers I've ever had. They loved me. I loved them. I loved my colleagues, my partners, the patients. I worked out of 10 offices there or so, and just really, really enjoyed the job. And now I continue to publish extensively, and I testified in the Senate, United States Senate with Ron Johnson. I was on Tucker Carlson. I've testified all over the world, been on hundreds, if not 1,000 or more platforms like yours. And I would feed all this information up the chain of command because I'm a military guy, right? I'm actually a disabled veteran.
Right.
So I know my chain of command. I would give that information to all the people at SSM Health. They summarily rejected it, just silence, would never speak on it. And I got an email from CEO Kevin Elledge, who was one of the underling CEOs. The main CEO is a a lady that I do know, and I've actually worked with her, Laura Kaiser. She's the main CEO of SSM Health System, but she sicked one of her underlings to do some dirty work, and the underling, Kevin Elledge, had to execute me, and he had to execute me, terminate me. Otherwise, they would have had to start paying that money back. So I knew it was coming. And in fact, Peter McCullough, my dear friend, for a year before, he kept telling me, just quit. You're going to get fired, and you're not going to last long. You're going to get fired. Just quit and come over to the wellness company with us. And it's like, Peter, I love the wellness, Dr. McCullough, I love the wellness company, but I'm not going to quit my job. I really like the people here. And, I love the patients and such. But anyway, sure enough, this Kevin Elledge emailed me under the guise of, just wanting to visit with me on the phone and get to know me better. And I knew what was coming. And Maggie, my attorney wife, was there for the phone call. It was on June 29th. It was about 1 p.m. Central Time. And sure enough, he called me. And Maggie and I wrote down everything he said. And it was a 45-minute conversation. And for the first 30 minutes, he said, hey, you're a model physician. Everybody loves you. Your patient scores are off the charts, good. Everybody loves you, and yada, yada, yada. You're a model physician, yada, yada, yada. And talked about that. And then about 30 minutes in the conversation, he said, well, I do have some bad news here that, we have to invoke your no cause termination agreement. So effective, you get 120 days to work and get paid, but then we're going to shake hands and let you go. And I said, oh, okay, well, no problem. And I said, well, why are you doing this? Why do you need to let me go? And he said, oh, it's no cause termination. You've been a great employee. We're just having some financial troubles, and we got together and decided that you were the one that needed to be terminated to help alleviate our financial problems. Well, I knew that was an absolute lie because I just got done telling you that by far and away, I was the largest money producer for the division of any other doc there, 5-fold greater than some of the more junior colleagues. So I knew that was a lie, but I kept asking him that to put him on the spot. And 3 times I asked him that. So he said, no. And then he tried to bribe me with $100,000 and said, we just, you've been doing such a great job, and we want you to sign this what amounted to a hush money agreement, a non-disclosure agreement, or a separation agreement, after I completed my 120 days. And I said, well, and he said, we'll give it to you now. And I said, no, I get, and he was really nice. He acted like he really didn't know what was going on. And maybe he did, or maybe he didn't, but I wouldn't take the money. And, I said, if you're having financial troubles, no, just keep the money, because I knew they were going to try to shut me up. And he got increasingly aggressive. But, well, if you don't need the money, your grandchildren do. You have 5 grandchildren. No, I'm not going to take the money. So anyways, he said, I'm going to email you 3 documents at the end of the call. He goes, reconsider taking the money. I said, I'm not going to take the money. And we parted. It was an amicable conversation. Within 7 minutes, Jeremiah, a system-wide email went out terminating me effective immediately.
Wow.
And my colleagues were shocked, and I was shocked because he completely lied, of course, and he broke the contract. It was a wrongful termination because for no cause. So, I will, it's very... I was shocked, and my colleagues were shocked. I immediately started getting all these calls and emails. What's going on? We just got this email. I was seeing patients up until, 12:30 or 1 o'clock. And, 45 minutes later, I'm fired, right? So it was so wrong on so many levels because, that implies that I was a horrible doctor and I did something bad. And, because you don't relieve somebody of their duties immediately and then lock them out of the system. So anyways, and not only that, they never paid me for my remaining 120 days. So I just let it go. But they had to do that, or they would have had to pay that $307 million back. And I'm really happy to be in this situation, get terminated, because, God always uses things like that with people of character that are making honest decisions and honoring God by speaking the truth. God has used that as a silver platter since I've been terminated for me to expose the entire corruption of not only SSM Health, but the entire hospital system. I've attacked them egregiously, vigorously, aggressively, and they're involved with lawsuits now, and I know that they've damaged and injured a lot of not only their employees, but they've killed and injured a lot of their patients. I've seen it with my own eyes. So I'm seeking plaintiffs' attorneys. Plaintiffs' attorneys for it's an unfortunate term. A baby that is damaged, they call it a damaged baby case. Those are $100 million cases, sometimes more, $200-300 million cases. So I'm requesting that plaintiffs, you can look at my ex Twitter account, and I'm calling for plaintiffs' attorneys to become aggressively involved with hospitals against hospitals and physicians and medical organizations, including my 3 organizations, to sue them for damaged baby cases and dead baby cases. And listen, the truth is coming out now. And these damaged baby cases, plaintiffs are going to start looking, their futures market for massive income off these cases is going to skyrocket. Listen, these damaged baby cases, when the truth comes out, it's going to make the tobacco litigation in the 90s look like chump change. So I'm working with plaintiffs' attorneys, and I'm gathering. I have a long list of patients all over the country that have had their babies killed or damaged, and I'm going to be feeding them to the plaintiffs' attorneys. And I know there's a lot of damaged and dead babies in the service area of SSM Health. So yeah, I am. I think that justice will be served, and this is what needs to be done.
Well, you've mentioned the truth several times, and I've said for years the truth might hurt, but it's still the truth. And I think it's really important that we face the terrible reality of what's transpired head on, because it's happened, right? To me, the big moment that I've referenced in my article, we missed our Muhammad Ali moment, was when they wanted to unload these experimental injections on the public. We had to say no. And when we failed to, as a unified community, as a country, as a global population, as we failed to do so, we've ushered in just unbelievably bad consequences that we are now facing. And that being said, I'm very curious from your perspective, Dr. Thorp. It's sort of an ongoing theme on this show, and it's part of my ongoing investigation. I'm really having a hard time, and there's so many features, so many factors to what we're dealing with, but I'm having a hard time gauging the extent of the damage that we're facing. Because, of course, if one person dies unnecessarily, it's a tragedy in and of itself. But it doesn't necessarily have a statistical impact when you look at, demographics across an entire society and across an entire population. But we're just seeing these articles every day. Another sudden death, another athlete dying, another person, dropping dead without any warning, without any sickness or injury preceding it. A person was just out and about with their friends the night before. Everything was fine. Everything was great. They don't wake up the next day. And many of these people are in their 20s, their 30s, their 40s. We're seeing indications from the world of cardiovascular health. We're seeing oncologists speak out. There's so many different areas where we're seeing injury and damage, and you just laid out some pretty alarming, concerning, terrible stuff from your perspective as an OB-GYN. What do you think we're looking at here over the next 5 to 10 to 25 years? What have we ushered in? I mean, obviously you don't have a crystal ball. No one does. But we have this issue of plasmid gate, that there's DNA contamination, whatever that means, plasmid DNA contamination in the vials. And now that's beyond debate. It's just a matter of to what extent is each individual vial contaminated. There's so many concerning things, so many alarming things. From your expert point of view, what do you think we may be dealing with again over the next 5 to 10 to 25 years as a result of this reckless behavior? Can you hear me, Dr. Thorp? Did we lose you?
Sorry. I'm sorry. No, you didn't lose me.
Okay, great.
I had a coughing fit, so I muted.
Oh, okay.
So,
Well, thanks for that.
I'm very concerned. And what's concerning, as you point out, that these deaths are accelerating. There's no stop. The cancers, the turbo cancers, it's just unbelievable. I've never seen anything like it. So, and now remember that 95%, maybe 98% of the Americans right now, today, the last 6 months, really the last year, are not taking these vaccines, the boosters. The vast majority of Americans, the uptake.
Which I'd like to point out, by the way, quickly. I'm sorry to interrupt you, Dr. Thorpe, but when you talk about the low uptake, is that because of anti-vaxxers and programs like this, that our propaganda is just so pervasive that people were influenced by that? No, I think that's a result of a lousy product that was on the marketplace, and people realize, hey, you know what? We don't want anything to do with that product. It is nothing. It's like this notion that the product and the negative effect of the product doesn't speak for itself. I mean, come on, it most certainly does. People don't want this garbage in their bodies if they've looked into this whatsoever.
You're absolutely 100% spot on. Maggie and I are not highly social people. We kind of stick to ourselves. Here we're not highly social because we're working so much time and working so hard, sometimes 18 hours a day.
Wow.
But we sat down and counted up. Maggie and I know 50 people that have either dropped dead or been had a turbo cancer or been severely injured.
Right.
50 people.
I mean, what's so crazy, Dr. Thorpe, is I could sit here and speak for the next hour or two about all kinds of strange injuries and deaths that I've observed since this has occurred. And if we got together in a group, I mean, you could almost get like a random group of 10 people. They could sit there and just discuss this for hours upon hours upon hours, at which point you say, well, we can't dismiss this as quote unquote anecdotal. All of these comments, all of these observations are clear indication of something that's not right. And
that's exactly right. That's exactly right.
And, maybe it's another case, which is not an unfamiliar thing of, well, maybe science isn't keeping up with what's happening on the streets. It's not uncommon that people communicate things faster than the official bodies are able to convey information and so on and so forth.
Well, there's a taboo. Nobody is willing to talk. 98% of the Americans know that they don't want another vaccine because they know, a recent poll showed that 50% of people know somebody that's severely injured, and 25% of people know somebody that has been killed by the vaccine. So, everybody knows, but nobody will talk about it because of this horrible psyops and this totalitarian.
And I'm sorry to interrupt you again, Dr. Thorpe. But I just wanted to also point out right here in terms of there's also a lot of people who are really unaware of the fact that there has been a clinical discussion about these injections being related to cancers, for example, or even heart conditions. It's a little bit more well known in terms of the myocarditis, word that's been disseminated into the public now as a result of this. But I'm just pointing out that someone might say, oh, what do you mean I got cancer from a vaccine? That's crazy. That's anti-vax nonsense. But no, oncologists have spoken out about this in technical detail. So a lot of people might not realize, oh, well, your family member who did die sort of suddenly, that was a vaccine injury. You might not be aware of the fact that there's a clinical background to something that you would consider totally unassociated with a vaccine. So I just wanted to mention that.
Well, that's exactly right. And we now, again, I look at what I absolutely know to be true with what I've seen with my eyes and my clinical experience. But then there's three sources of data that are absolutely, exclusively irrefutable that shows the death and injurious nature of the vaccines in the general population and in pregnancy. And I'll just cite those real carefully. Those three studies or data sources, by the way, two of the three are from Pfizer, and one of the three is from the government. And they're irrefutable, but yet the government controls all the organizations, all the hospitals, and they control all the medical journals. Those three sources of data can never be changed because they're irrefutable. But the government and the fraudulent medical journals will continue publishing falsified data that was ghostwritten by the pharmaceutical industry, like the New England Journal of Medicine and Shimabukuro, like the Lancet Medical Journal with Dr. Mehra. And, for example, in pregnancy, there's probably 32 articles now suggesting that the vaccine is safe in pregnancy. All of those articles are closed data sources. You're not allowed to look at them. They all come from institutions that have heavy conflicts of interest. The authors were all vaccinated because they come from institutions that have been vaccinated, and those institutions are heavily funded by the NIH. But here's the three irrefutable data sources. Number one, the Pfizer 5.3.6 post-market analysis after 90 days of rollout, which was available in February 28, 2021. And a whistleblower from Pfizer or from the FDA released that in early 2021. Everybody in the world had it. And then they tried to hide it for 75 years, and a federal judge, thank God for Aaron Siri of the Informed Consent Action Network, that was released formally, publicly, legally on April Fool's Day, 2022. On page 7 of that document, this was the deadliest and most injurious drug ever rolled out. And I want to focus some time on that. You mentioned something earlier, a dead person is a dead person. Well, we got a lot of illegal immigrants coming in, they can be replaced. Okay, and there is some issues with the workforce and so on and so forth. But here's what people haven't really focused on. To my knowledge, I'm the only one that has pointed this out. This drug, on page 7, there were 42,086 casualties. And of those 42,086 casualties, there were 1,223 dead. By far and away, the deadliest, most injurious. Do the math. The injure-to-kill ratio, according to Pfizer on page 7 of that document, is an unprecedented 33.4. So this explains why that means to your audience, for every person killed, multiply that number by 33.4. So when Dr. Denis Rancourt last year, almost 9 months ago, almost a year ago now, says that 17 million people globally have been killed by the vaccine, far more than that now. Multiply that times 33.4. That was last year. 568 million people have been injured. And that's what takes the an even larger toll on our society and on the world globally, on the workforce. This explains Ed Dowd's number, why, the workforce, the death and disability claims in the workforce is unprecedented rise. And there's no other explanation for it except the vaccine, because that's the healthiest segment of our population. So also, it's important to say that a injury to kill ratio. I'm a military historian. I know I'm a former military officer. I'm a disabled veteran. Listen, the injury to kill ratio in war. Say, for example, the 2 atomic weapons were dropped on Hiroshima and Nagasaki. The injury to kill ratio was only 0.9. There were only 94,000 people injured and 105,000 killed in Hiroshima and Nagasaki in August of 1945. Listen, Borla and Bansal, the butchers, and Pfizer, Moderna. I mean, they make those 2 atomic weapons look like a walk in the park, look like child's play.
Yeah.
Remember, 585 million global citizens have been killed or injured. So that's irrefutable source of data. The second source of data is actually the VAERS, the Vaccine Adverse Event Reporting System. And, there's irrefutable data from that. And the government hates that, and the people that are paid off, the Harvard and the other institutions paid off and taken all the NIH, they're trying to, downplay that. But the reason they're downplaying it is because they can't control it. They do cheat, and they try to throttle it, and they try to hide the deaths. But the death and injury signal is so high that they can't throttle it. And they're trying to replace the VAERS system with systems that are closed source and that they can control, like the Vaccine Safety Data Link and many others. The third source of data, at least for pregnancy, that's irrefutable, is the pregnancy, the phase 2, phase 3 pregnancy randomized controlled prospective trial from Pfizer themselves. And this was completed in July of 2022, and it was released a year later. And they tried to hide it. They tried to obfuscate it. They tried to put it in, a needle in a haystack of all this other trash and nonsense. But I've studied that. And the study was horribly underpowered. There were only 315 patients in it. But when you look at the babies that were delivered from that trial, half of the 315 received the vaccine, the other half received the placebo group. But let me tell you something. Those babies who were given that vaccine compared to the placebo group were absolutely horrifying. For example, there was 100% increase in the vaccine babies that got the vaccine in their mother's womb. 100% increase in low APGAR scores. That means a depressed baby, a baby that needs help at birth that's in trouble. 100% increase. Some of those babies needed to go to the NICU, the neonatal intensive care unit, need to be given CPR and resuscitation. Number 2, there was a substantial increase in a syndrome called meconium aspiration syndrome. That's basically where the baby passes stool in the womb. It's green, meconium, and when they get low on oxygen, they aspirate it into their lungs. That's life-threatening. Right. Number 3, there's an 80% increase in jaundice in the newborns. Number 4, there's a 70% increase in birth defects or congenital malformations. Number 5, specifically with regard to cardiac malformation, a hole in the heart, there was a 220% increase. Number 6, there was a massive increase in growth-restricted babies that are starving because their placentas aren't functioning. Wow. Number 7, there was a substantial increase in skin defects, one of them called congenital nevus, or it's a kind of a vascular malformation or hemangioma, 200% increase. And number 8, the worst, the most concerning, there was a 4.1-fold increase in babies with birth defects and congenital developmental delays at 6 months of life. That's how long they followed up the baby. If a baby has a developmental delay at 6 months of life, they usually don't rear their head unless they're pretty severe that early in life. So going back to the capture of these 60,000 OB-GYN doctors, these 60,000, when they're counseling their women, these women are trusting them in their first prenatal visit. And they're trusting that this doctor is an independent and cares for them and cares for their baby. You know, intimate examination, pelvic examination, probably the most intimate examination and relationship a physician, patient could ever have with a physician. But yet that physician was nothing more than a mouthpiece of lies and disinformation under threat of losing her job or losing her salary from the hospital, like I did, or losing their license or losing their board accreditation. And so it was so unethical. You know, the government used these trusted relationships to exploit these women and use them. You know, you and I, Jeremiah, no woman, pregnant woman, if their obstetrician sat down and went through those 8 abnormalities in their babies if they took the vaccine compared to placebo, no woman ever would have taken the vaccine. Right. Yet this data is still hidden.
Yeah. Unbelievable. I mean, wow. I mean, we have to work so hard, all of us, to wake people up. And, you know, some people, I don't know, I've said this before, but you can't wake someone up who's pretending to be asleep. It's kind of hard to gauge at this moment who's actually sleeping and who's just pretending to be asleep at this point. Because, I mean, how could you not react to this information? I mean, again, the harming of the most innocent of all of us. I mean, unborn children. You can't get more innocent than that. And the vulnerable pregnant women that have to, you know, create these lives, the future lifeblood of society. I mean, how can we not react to this? It's unbelievable to me. That's why this program is on a weekly basis. These matters must be addressed. We are not going to go quietly into the night about this stuff.
Absolutely. You know, there's one more aspect about this whole kind of people not being able to connect the dots, and this is other data that I've published on a year ago, and I published again recently from the VAERS data. You know, there's a huge increase in severe mental, cognition, intelligence, complications, dementias, cognitive disorders, intellectual disorders in those people that got the COVID vaccine compared to other vaccines. I mean, huge risk. And number 2, same thing with psychiatric issues, psychiatric disorders. If you take all of the, I think there's 7 or 8 psychiatric abnormalities that are in VAERS. And when I look at all of those, massive increase in those people who have gotten the COVID vaccine compared with all other vaccines. And then the same for suicide and suicidal ideation. So, you know, you really wonder whether people like, you know, this Peter Hotez, who's lost his mind, and these other doctors and organizations who continue to push this vaccine to the most vulnerable people, if they don't have some intellectual, cognitive, psychiatric issues related to the vaccine, I really think that it's my opinion that people like Peter Hotez and these other people that are continuing to push this, they're either just blatant trolls and evil people, or they're mentally disturbed by from the vaccine.
Yeah, we can't discount that, honestly. We really can't discount that. Yeah, I mean, wow, what a situation that we find ourselves in. And like I said in a Twitter space a couple days ago, the bad news is this terrible stuff that's happening and that's already happened, and certain things we simply can't reverse, unfortunately. The good news is there are a lot of courageous people speaking up. There are a lot of really intelligent, well-trained people, such as yourself, Dr. Thorp, and other doctors who are now starting to work in coalition and are starting to make alternative networks of wellness for people, and that can be a really great thing, in the future as we start to, right these wrongs one by one, and also demand justice for the crimes that have been committed. We're running out of time, unfortunately. I've been given the signal from the engineers, my man Dylan, working hard over there at the board, and Ryan. Shout out to Dylan and Ryan, PRN engineers, doing a great job every day. But also, please, everyone, check out my new Substack article. I just published an article yesterday. It's my 16th article, and it's called The Contradictions Between Right and Left, Contradictions Between Left and Right. And I said left first. Contradictions Between Left and Right, as underscored by COVID. And there's some awesome comments under there, great little dialogue under the article. Please subscribe to my Substack for free. When I put out that article yesterday, that was actually my 1-year anniversary of my Substack. And that's been a great experience. And
congratulations.
Yeah, thank you so much.
It's a great Substack.
I appreciate that so much. Well, Dr. Thorp, it's been an honor to have you as a guest. I hope we can have another interview, because there's other questions I really wanted to ask you, but there's so much to go over. I mean, 1 hour is certainly insufficient for this ongoing conversation. But just thank you, and thank your wife for your courage and for your diligence and for your wisdom. And I wish you all the best, and looking forward to working with you in any capacity that I can do as we continue to get the word out and continue to demand justice and continue to try to get support for the vaccine injured, who are just so numerous.
Yes. Thank you so much for having me on.
My pleasure. Have a great day, Dr. Thorp, and have a great weekend. We'll be in touch.
God bless you. You too, Jeremiah.
Thank you, brother.
It is something that you do.